to survey the scene. So we have to check if the scene is safe, and if it's safe, then proceed. If not, we have to transfer the infant to a safer place. Okay? And then next is we have to introduce ourselves. I am Judy Ann Parnas Dora, trained first aider. Can I help? And if the answer is yes, proceed. If not, you have to repeat yourself. I am Judy Ann Parnas Doro, a trained first aider. Can I help? And then, if the significant others are reluctant, then that's the time that we can show our Philippine National Red Cross ID. Okay? And then, the next thing that we need to do is to kneel on the side of the victim. The legs should be separated, and then you may state that the PPE is on, BSI is on, and then the face mask and gloves should be worn by this time. Okay? And then the next thing we need to do is to check for the level of consciousness of the infant by tapping or rubbing the soles of the baby or the victim at least 3 times. Hey baby, are you okay? Hey baby, are you okay? Hey baby, are you okay? And then if the infant is conscious, we have to position the baby, or we have to carry the baby on our shoulder like in a burping position, and then apply back rub, then transfer the infant to the nearest hospital. But if the infant is unconscious, then we need to seek for help immediately. Hey ma'am in yellow shirt, help. Activate emergency medical service or call an ambulance or any transfer facility as I check the circulation area and breathing of the victim. Okay, so to check the CAB of the victim, let's do that for not more than 10 seconds. So we have to observe for the chest movement, and then listen for the breath sounds, and feel for the brachial pulse. Okay? So that's 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. If negative breathing and pulse, follow up for the EMS and perform CPR. Ma'am in a pink shirt, follow up emergency medical service, call an ambulance or any transfer facility as I perform CPR to the infant or to the victim. And then position the head of the infant in a neutral position. So next is we have to check, locate, lock, and use the 2 middle finger of our dominant hand. Okay, so like this. Okay, so let's start with the rescue breath or breath puff, then puff again. Puff, release, puff, release. 1 and 2 and 3 and 4 and 5 and 6 and 7, 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and 1 and 2 and 3 and 4 and 5 and 6 and 7, 8 and 1. Puff, release, puff, release. 1 and 2 and 3 and 4 and 5 and 6 and 7, 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19 and 20, 1 and 2 and 3 and 4 and 5 and 6 and 7, 8 and 9 and 2. Puff, release, puff, release. 1 and 2 and 3 and 4 and 5 and 6 and 7, 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and 1 and 2 and 3 and 4 and 5 and 6 and 7, 8 and 3. Puff, release, puff, release. 1 and 2 and 3 and 4 and 5 and 6 and 7, 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and 1 and 2 and 3 and 4, 6 and 7, 8 and 9 and 5. Puff, release, puff, release. Alright, and then check for the CAB for not more than 10 seconds. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. And then, if the victim has negative breathing and positive pulse, follow up for the EMS. Hey ma'am in yellow shirt, follow up emergency medical service, call an ambulance or any transfer facility as I perform rescue breathing to the victim. Okay? So to do that, position the head in a neutral position. So we have to seal the mouth and the nose of the infant using our mouth, and of course give rescue breath. Alright, so again, rescue breath starts with a puff and ends with a puff. Puff release, 1001. Puff release, 1002. Puff release, 1003. Puff release, 1004. Puff release, 1005. Puff release, 1006, puff release 1007, puff release 1008, puff release 1009, puff release 1010, puff release 1011, puff release 1012. And then once you're done with the 40th cycle, give the infant another puff. And then, of course, check for the circulation, airway, and breathing for not more than seconds. 1, 1000, 1, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. And if negative breathing and negative pulse, do the CPR again. And if the victim is positive breathing and positive pulse, position the victim in a recovery position. And then apply back rub, then transfer the victim to the nearest hospital. And if the victim is conscious and no response, do the head-to-toe assessment and management, or again, or the cephalocaudal assessment for a possible surgical case. And then check if there is no blood, no deformity, no open wound, no tenderness, no swelling.